Hi, my name is Mary McCauley, and today I will be discussing cupping therapy as a technique and treatment method used in clinical care, sports medicine, and other animals. So, when you first think of the term cupping, what's the first thing that comes to mind? Well, for me personally, it is the 2016 Rio Olympics with gold medalist Michael Phelps as he took the swimming platform with purple and red bruised circles around his back and shoulders. In fact, as I mentioned, cupping actually dates back to 1550 BC in Egyptian practices to treat hypertension, headaches, and drug overdose. This used to be called al-Hammam, which is Arabic for wet cupping. More recently, Western medicine has adopted this due to its safe, non-invasive, inexpensive method of treating a variety of conditions. Now we'll kind of look at the two different types of cupping that are mainly used in research and clinical practice. So dry cupping is first the classic. We have the small glass and plastic cups are placed on the skin region of interest. These are typically the chest, back, abdomen, and legs. After this, we want to create a negative pressure within the cup, so forming a vacuum through heat using a flame or a manual pump. This suction will bring blood to the surface of the skin and blood vessels and increase blood flow to the surface. After a few minutes, this cup will be removed, leaving that circular bruise red or purple. And it's also important to have this therapy done by qualified clinicians or practitioners to avoid any risks or harm. The largest side effect from cupping therapy is bruising of the skin. Now we look at wet cupping, which is actually the same process as dry cupping, except once that suction brings the blood to the surface of the skin, a bladed needle will be used to extract blood through a skin incision. And the removal of the surface blood aids the toxin removal and reduction of inflammation and increased blood flow. So here's a video kind of summarizing what it looks like. Now that we've looked at cupping as a whole, we'll look at the different mechanisms that explain the therapeutic benefits of this treatment. I also want you to keep in mind that it has not been fully proven that this cupping is not a placebo effect due to our lack of understanding what mechanisms work behind cupping. So also keep in mind that we don't fully understand. So from researchers from the National Center of Complementary and Alternative Medicine, we know that there are several theories that suggest what mechanisms underlie cupping therapy from 64 studies. So here we're going to look to our right at the main effects of cupping and what theories support this. So first we'll look at pain reduction. So this is supported by three different theories, all looking at pain modulation pathways. So the first pain gate theory, we're looking at nociceptor stimulus, which close your pain gates, whereas the second, we look at DNIC, which creates a pain to counter current pain, so pain inhibits pain, whereas the reflex zone theory is what is used to treat carpal tunnel syndrome with cupping by targeting the certain reflex for increased blood supply and pain reduction. So next we'll look at muscle relaxation and circulation. This can be understood through the nitric oxide theory. So here from this image to our left, we see that the release of nitric oxide from the suction of cupping released from endothelial cells actually signals vasodilation, a decrease in blood pressure, a decrease in platelet aggregation, and increase of other downstream effects such as increased muscle relaxation and blood circulation for healing. Another effect, we look at the immune and inflammatory response. So we know through research that cupping can decrease levels of IgE, which is an antibody for allergens, and IL-2 levels, which is a cytokine activated by T cells. It can also increase C3 levels, which is a complement indicator of inflammation. And it does this by using our body's natural immune system for healing. So it creates an artificial local inflammation site, which activates the complement system of cascades and increases immune system products of IFs and TFs. And lastly, we're going to look at the removal of toxins. So this is mainly through wet cupping, and we look at how by removing the blood flow at the surface, we can release toxins and also remove heavy metals such as aluminum, mercury, silver, and lead. A lot of this theory is similar to the use of leeches medically to remove toxins, and the removal of heavy metals can help treat patients with diseases common with heavy metal deposition. Now that we kind of understand this whole, the effects of cupping and how we can use this, we also have to keep in mind that the placebo effect can still be true. Now with the applications of cupping, we can see it in medical treatment, sports medicine, and various animals. Clinically, as mentioned previously, Western medicine has adopted cupping as a holistic treatment for various conditions. Research and clinical evidence suggests its beneficial use in some of the following diseases, such as herpes zoster, lowering blood pressure for cardiovascular disease, diabetes, musculoskeletal pain, rheumatoid arthritis, carpal tunnel. And we know overall that it causes muscle relaxation, increased blood circulation, decrease in cholesterol, and helps prevent other diseases. Secondly, we're going to look at sports. So as I mentioned, look at athletes. Various headlines has kind of raised attention to cupping. We see Chinese swimmer Wing Yun in the 2008 Beijing Olympics, linebacker James Harrison of the New England Patriots, and the boxing world, which they actually believe that cupping may be bad luck. We don't really know a lot research-wise how it affects sports or athletic performance, but a recent 2020 pilot study looked at wet cupping on anti-inflammatory action in vigorous exercise in martial art athletes, which revealed significant decreases in inflammatory markers for those who received cupping versus those who didn't. However, it's difficult to use these conclusions for vigorous exercise as a whole due to the narrow focus on male martial arts athletes in a small sample size. In 2021, we also see the investigated roles of cupping in reducing neuromuscular fatigue after athletic training, so using EMG data to measure fatigue after completing bicep curls between a treatment and control group. Data actually suggested reduced muscle fatigue after cupping. However, there's many limitations with a small sample size, and bicep curls don't really emulate real athletic sports. When it comes to animals, we really don't know much. All we know is 2017, some research on Wistar rats showed significant pain modulating effects of cupping by measuring pain threshold and SP7 and beta endorphin levels. So we see the benefits in rats, but however, a 2018 study of Arabian horses really showed minimal changes, only a significant decrease in cortisol levels at day 3 and 14 after cupping. So here we see this in the graph provided by the data here. Also, we see like canines, there's actually no significant evidence. We're still looking at that. There's not really been any studies, but it's still practice. There's just no evidence of application. And then overall, we just have to keep in mind that like this is still an exploratory field and we don't know a lot. So we really want to compare this to other non-interventional techniques and how this plays a role. So references here. And Personally, this therapeutic method offers promising treatments for various conditions and potential to reach greater populations due to its non-invasive, safe, cost-effective use in comparison to other alternative medicines. However, I do not think there's enough evidence to solely rely on cupping as a method of medical treatment. In addition, it is not completely clear about the role cupping has on athletic performance and recovery in comparison to other non-surgical methods. Overall, the popularization of cupping from the 2016 Rio Olympics has introduced value in a holistic traditional medicine practice, but we still are presented with limited research.